Welcome back to Suncoast FYI. Continuing with health, we turn to orthopedic surgery. Alexander Orthopedics Associates, Dr. Vladimir Alexander, whose state-of-the-art surgery center specializes in knee, hip, shoulder surgery, and much more. And we'd like to welcome you to the show, Doctor. Thank you for being here.
Good morning.
Tell us, who is the appropriate candidate to have your outpatient joint replacement?
So the appropriate candidate is generally somebody who is in good health, usually younger than 65. Sometimes you can be older than 65, but you got to be relatively healthy, and you have to have a very good support system at home.
Okay. And why is it better or beneficial to have your joint surgery performed outpatient as opposed to in-hospital stay?
Well, if you meet those criteria, and we started this program about 6 years ago, we figured out that for most patients, the hospital stay was more of a detractor than a helper. We find that if patients go home, they can have the care of their loved ones. When you ask your loved ones for a pain pill, you generally get it pretty quickly. When you're in the hospital and nurses are overworked and understaffed, very frequently it's very hard to get immediate care when you need it. So by doing the surgery in the surgery center setting, we find that the infection rate goes down because it's a cleaner place. Only healthy patients go there. Only patients without significant disease or infection go there. Infection's a big problem with joint replacement. So if you do it in the outpatient setting, just by decreasing that variable alone makes it much more successful. That and the fact that they can recover at home in the comfort of their own home, where they're not being woken up several times in the evening hours and in the late night hours, makes people recover faster and better.
Okay. Now, so when they go in and they have outpatient surgery, how long are they actually in your center?
So they generally check into the facility approximately an hour to an hour and a half before the procedure.
Okay.
The procedure takes somewhere between 45 minutes to an hour and 15 minutes, and then they recover usually for about an hour and a half to 2 hours.
Okay, before they go home.
Before they go home.
And how long have you been performing these, and how many have you done in your...
Sure. I've been an orthopedic surgeon for over 20 years. We've been in practice in St. Pete for about 16 years, and we started this program about 6 years ago. So I've been doing joint replacement for over 20 years, and this program is now about 6 years old, and now we've done hundreds of these as outpatient.
Okay, now I know that you've created this unique outpatient program. So could you explain to our viewers exactly what that process is, step by step for us?
Sure. So the outpatient program entails, we have an outpatient joint coordinator. So when the patient gets set up for surgery or they're a candidate for the surgery, they will meet with the joint coordinator. The coordinator will speak to them about the protocols that are involved. We also have a mobile therapy team who goes out to the house and assesses their home pre-surgically, so that before surgery we know what the dangers are in their home. Make sure that they have all the ambulatory aids, the appropriate raised toilet seat, things like that, and sets them up with a walker, cane, any ambulatory aids that they may need. Also, with the therapist knowing the home, that's the same therapist that goes to the home after surgery, and the patient now knowing the therapist, it gets them very comfortable. So this is sort of our all-inclusive team approach, where we want to be as comfortable with our patient as our patient is comfortable with us, and that's really been a tremendous adjunct for growing this program.
So when you send home one of your physical therapists with them, how long does that usually, depending on the surgery, I imagine, how long does the physical therapist come to the patient's home?
Preoperatively, the visit is usually somewhere between 45 minutes to an hour. After surgery, the therapist comes to the house until the patient is comfortable traveling in a vehicle on a regular basis. Once the patient is comfortable traveling in a vehicle, which can be, depending on the surgery, between 1 and 4 weeks, then they will come to the outpatient center for therapy, which we offer at our facilities as well.
Okay. Can you give me a list? I mean, I went on your website and I saw, like I said, that you do much, much more than the several replacement parts that I mentioned, you know, hips, joints, feet, ankles. What else? What else could a person come in and
Sure.
expect?
We're a fellowship-trained, subspecialized practice, so all the providers, all the surgeons in our practice are fellowship-trained and are specifically geared towards doing certain types of surgeries, so very specialized care.
Okay.
I do hips, knees, and shoulders, replacements, and arthroscopy, or sports medicine, as most people would call it. We have a foot and ankle specialist in the practice, we have a back specialist in the practice, and we have a hand and upper extremity specialist in the practice.
Awesome, awesome. Now, what makes your practice the best practice in the Tampa Bay area, doctor?
I think what makes our practice the best practice is the fact that we take the best care of the patient from the very beginning to the very end. We care, we want the patient experience to be the best that they can absolutely have anywhere, including all the small TLC steps involved in doing that. And we have the experience. We've been in the same community for a long time, and we have grown as a practice tremendously from starting it out 16 years ago as one person in a very small office to now having locations in Largo, St. Petersburg, Brandon. We're in a very, very good place as a practice and very comfortable with ourselves.
Great.
And therefore our patients get better care.
Great. Sounds wonderful. Sounds like absolutely the place I'd want to go. So can you tell our viewers where they can find you, your website?
Sure.
And contact
Our
information?
website is alexanderorthopedics.com, and our locations are all over our website, so they can find us there.
Okay.
And
Great.
that's where we are.
Thank you so much for being here
Thank
today.
you so much.
Appreciate it.
Appreciate it. Thank you.
They've only been on the Suncoast for 6 months and already are a standout hotel in Sarasota. We'll talk with Jason Sampson, General Manager of Aloft Hotel, and Janet Hansen, Director of Sales and Marketing, right after the break.